So again, good day everyone. So we'll continue with our discussion on the nursing informatics. So let's have first the review of what we have discussed last time. Last meeting we had a discussion on the key points of data defined accordingly. What are those data, information, and knowledge? And it has been clearly presented to you the basic and simplified definition through examples. So the data, these are considered raw. These are from observations. This could be terms, numbers, identify its specific identity. Which, for example, when I gave the example on 89, when I give example of 14, this may not specifically identify of what does it mean. If a symbol is presented to you and you don't have any knowledge and awareness of it, so that still be considered as data. When this meaningful, okay, meaning answer the 5 Ws, the who, the what, that had been considered as meaningful and beneficial is now considered as information. So if we considered 89, that it is referring to 59 kilograms, 59, that's 110 pounds, then that is we are referring with the weight. If we are referring specifically to 37.5 degrees Celsius, so this information is referred to a temperature. Now, this will be considered as knowledge if you explore that this temperature can be now considered as normal body temperature, or if the weight that I told you, which is 59 kilograms, will be supported by the and may serve as analysis for comparison if it is within deviation or normal, then it serve all. We consider information such as kilograms and pounds. We are aware that we have the metric and we have the other English system, which considers its measurement or specific measurement, which vary accordingly through the use of pounds or kilograms. So through that comparison, it may give us the idea that if the person is still on the ideal body weight, but still may support other needed data, just like as what we have mentioned, 98.6, 89, and female. We just know 98.6. We don't know if what does it mean 89. What does it mean female? What does it mean? As long as it's a raw, it's considered raw, and you cannot answer the 5 Ws of what does it mean, then that considers data. The information now answers the 5 Ws, which those that I have presented, the raw data that had been presented, gives now a meaning if we put degrees Celsius, kilograms, and female as a gender. Then we have also, as a review, we have also discussed about the connection of how nurses will utilize the concepts of interventions, patient, problems, and outcomes. The clinician that are referred to this framework or to this model is referring to nurses. The healthcare interventions are related to the care management. The patient is referring to the target population or individual as well. The problem is identified specifically to the extent that it may not just only be a data, but it is converted into specific information. And the outcomes will be the solution, or rather the answer to whatever situation had been presented as a theory, which we have mentioned in this as a real world. Public health nurse is now considered as clinician. The high-risk pregnant teen is now the person or individual. The substance use is considered the problem, and the needed healthcare is basically what the expected outcomes. So the next question is how we converted this into data and information. When it comes to data, we have identified high-risk pregnant teen as data. Why we considered high-risk pregnant teen as data? Because we have identified, we may ask questions, why high risk? What is the age of the teenage person? So as long as you can answer these questions, this refers to data. Then substance use problem is considered a data because if you will ask question, what is the substance being abused? So the answer is still hanging. That is considered data. Care outcomes that are being presented accordingly to solve the problem with substance abuse of the high-risk pregnant teen. How we will the data may need possible to make this high-risk pregnant teen into information is we will use demographic data. Demographic data may refer to the teen, since it indicates the teenage, then we must be aware when it comes to the stages of development. Actually, teenagers are adult. What is the specific? We have young adults and we have older adults. So if we're talking about the teenager, we are referring to young adults. Thus, we must identify what age. One of the demographic data that we may consider is age. Demographic data may consider also gender. However, it's very obvious that only female, okay, only female will become pregnant. The next question is how this becomes a high-risk pregnant. Okay, as a high-risk pregnant, this considers as when the person has an underlying condition. Now, how we will convert this data in terms of information? What are those problem terms? We must identify what specific substance abuse had been identified. Is it heroin? Is it codeine? Is it alcohol abuse? Is it methamphetamine hydrochloride? Healthcare interventions are being identified and the needed healthcare that meant from the substance abuse. Then the healthcare So these are a typical example to be converted into information. Another example, a critical care nurse attends to a pediatric client with congenital defects that may need immediate care. Now, let us identify from the framework. Now, we must identify what is the population or the individual or the patient. Next, we must also identify what. So if we will try to consider the critical care nurse as the clinician, the pediatric client is considered as the patient. Congenital defects is considered as the health problem and needed immediate care is these are considered data because pediatric client may across ages to data to a useful information. And that later on will identify how we will convert this into information. Congenital defects identify many parts of the body because any defects that may happen intrauterine may be considered a problem with the heart, a problem with the intestine, a problem with the brain, congenital defects. Now, for the needed immediate care, since emergency care that will be given. So all of these are data. We have converted this into pediatric client is data because we can't identify information. Next, need immediate care is very specifically of what emergency interventions can be done or into information. Pediatric client could be 8 months old, okay, 8 months old female. What is the congenital? Specifies the heart. We could identify congenital heart defect such as pericarditis. It's the inflammation of the pericardium of the heart. What is now the emergency is this measure must be successful. And how could it measure? It could be measured typical examples pertaining to the data, information. Any questions on the data and information? If none, we may continue. Semantic tools. Actually, semantic tools are the ones that helps transform or convert. In short, these are you're about to search. Specifically, terms which are not familiar to you, what you will do. Again, question, students. When you're about to encounter numbers which are not familiar with you, how do you usually solve the problem? For you to be aware or even symbols. What do you do? Almost majority of you are web sources. And what are those web sources? Very good. You may search it through Google or meaning. As of the moment that which are textbooks, nowadays we do have the ebooks. Ebooks may be considered as meaning tools because this could be a source of meanings of terms, of even numbers. So that's why if we say semantic relates meaning and language. Okay. If all of us, for example, are nurses, we may understand that when we are administering drug intramuscular, she or he means. So that's why for a layman, she will or he will use semantic tools so that the intramuscular can be defined through its meaning, and that is what we call semantic, to relate meaning and language. What could be the common language for all of us? Student nurses, you are aware what intramuscular means because you have learned it in a formal education in college, facilitators, and clinical instructors. Another, very common, right? During our pharmacology class, Odipine may be considered only as a drug. But remember, a drug is data because there are many drugs specific and you want to know the classification antihypertensive. But to give more meaning to it, amlodipine ending in dipine is calcium channel blockers. Calcium channel blocker will relate to its meaning from a source, then that is semantic, and you will use semantic tools. Any questions so far, students, on the difference with questions so far? If none, I will continue my slide. Next, these are now what we call semantic tools. The semantic tools that I will be considering now are those that are being used in healthcare. Controlled vocabularies are words that have definition and represented by codes. Most of the codes, abbreviations, are considered controlled vocabularies. Why it is considered controlled vocabularies? Because this may not be meaningful to layman's. This could be meaningful for those who may have formal education, who have already learned about those codes, so that you will, so words that have definition and represented by codes. So if we say ICD, ICD is considered as an international. What does ICD mean? Of what does ICD mean? You are considered what? You are considered as a medical transcriptionist. How about the medical transcriptionist? A medical transcriptionist is the one who have analyzed specifically the interpretation of data. Example, why here in the Philippines, medical transcriptionists must have specific training because international codes are being used so that it must protect the patient. The medical transcriptionists here in the Philippines, who are most considered nurses, have attended training on ICD codes. If we will try to identify what does ICD 9-CM means, then we may not be aware of what does it mean. But as controlled vocabularies for those experts, you may consider this as one that are being used for ICD 9 is considered CM, cardiomyopathy, heart. So this may not be understood by a layman. This could be understood for those who have been trained with ICD. We are familiar, okay? RX, we are aware that this is a symbol for what? Student. Any response? Students, what does RN means? RX rather mean?
Prescription.
Prescription. Thank you very much, Miss Susano. Prescription. For all who may know specifically this RX, can you identify individuals or professions who may understand what RX means? Doctors will do. Pharmacists will do.
Pharmacist.
Correct. Pharmacists will do.
Physicians.
Physicians will do. Any other?
Nurse.
Nurses will do.
Doctors.
Okay. So, why we consider this as controlled vocabularies? Because very few professions, it may not be understood by the layman. But somehow, for the majority or for the laymen, since they have been exposed into the process of consultation with doctors, and they have already hold or RX, they have understood it as prescription. But on the professionals may identify RX. So controlled vocabularies are words that have definition and represented by codes. Next, ontologies. When we talk about taxonomies, this may identify or define relationships. Example, ontology for population. When we talk about ontology, this studies about taxonomies. This concerns as terms in relation to each other. Question, sir. Can you give me example of taxonomy or ontology? Anyone who have been aware in science of taxonomy? In biology, we do have taxonomies, right?
Yes
Students?
po.
Okay, can you give me example of taxonomy in science? Class, di ba? There are, for example, taxonomies. Vertebrates, invertebrates. We are familiar of has no backbone. Sub-cluster. Under the invertebrates, we have sub-clusters. All of the terms under the all of the animals or microorganisms or parasites, anything that have been identified under vertebrates and under invertebrates, we are familiar that those all that have been under vertebrates are, and for the invertebrates, those that do not have backbone. Let us now relate this on the aspect of, let us now consider taxonomy. The taxonomy that we're considering is related to taxonomy of nursing diagnosis. For taxonomy of nursing diagnosis, for example, it could be either circulation, it could be under neurological, it could be either respiration. From the circulation, respiration, neurological, these are the areas of assessment, right? But whenever you have findings, for example, if we are talking about problems with blood pressure, if we talk about blood pressure, how can we classify accordingly to this functional assessment? Is it under circulation, respiration, or neurological? Answer.
Circulation.
Very good. We connect this with the VAR I may address to you, may consider the specific and correct assessment findings when it comes to area of assessment. Two, positive Babinski reflex. This is related to your assessment to pediatric or newborn. Is it circulation, respiration, neurological? Answer.
Neurological.
Very good. The answer is neurological because reflect the stimulus of nerves. Thus, we considered it under neurological. Next, how about if findings are, if the client is having 25 breaths per minute and in respiratory distress? Is it circulation, respiration, neurological? Answer.
Respiration.
Respiration.
Respiration. Correct. Now, that is what we call taxonomies. We can identify specifically to where it could branch out. Other than that, for example, since we have mentioned that we have 25 breaths per minute and in respiratory distress, it's under respiration. Now, we can classify it accordingly if it is normal or deviation. Since the client is in respiratory distress, then the patient could be in the aspect of deviation. That's why the taxonomies will guide you when it comes to your physical examination findings, which if your findings may identify specific area and considerably if it is deviation or normal findings. Next slide. Next slide is related to interface terminologies. Interface terminologies are terms that facilitate direct entry of information into a computer. Just like, for example, if you say interface, there must be what? Entry of information. If we say entry of information, the person or any individual will be the key who will significantly put information to a storage, which is computer. Just a typical electronic health records are records of patients that have been stored in a system of a particular facility, either hospital, clinic, or health center. Just like, for example, when you look for the information wherein how many patients, how many patients are admitted for the day? How many patients are admitted for the day? You are talking about number, an updated number. Now, the how many patients are admitted is still very broad because all, obviously, that have been admitted in the hospital, well or sick individuals are patients, right? To consider interface terminologies, we identify patients as inpatient or outpatient. So through the terms that we have applied, the number of patients that are considered as outpatient and the number of patients that have been considered as inpatient. Because when you enter data in electronic health records, and upon completion, there is a menu there if the client is identified as outpatient or inpatient. To navigate the information and strategize to know the updated number of inpatient and outpatient, it could be easily generated simply because, to what extent, we have already identified to each profile of patient if he or she is inpatient or outpatient. Who significantly entered the information? The person in charge. It's not automatic. It's individualized, it is organizational and institutionalized. If we say patients, inpatients, and outpatients, inpatients and outpatients may vary number with other hospitals. Am I right? But if you are talking about or referring only to the data that are being utilized in your own institution, such as the hospital or MCU hospital, then it could be generated accordingly for the person to indicate its specific identity. Either use the demographic profile. About patients, we're talking about inpatient and outpatient. So these interface terminologies are being utilized when the person entered information to the system of the facility. And that interface terminologies are the ones that had been utilized by organization, and those informations are aware. Those informations, we consider that everyone is aware in the hospital as a basic layman. So that is what we call interface terminologies. So we have the control terminologies, we have taxonomies, we have interface terminologies. Next is we have reference terminologies. Reference terminologies is a set of concepts and relationships that provide common reference point for comparisons and aggregation of data. If we say reference terminologies, this will give you idea of using the term of comparisons. Examples. On the interface terminologies, we have identified specifically the number of inpatient and outpatient for the day only. But if we will consider reference terminologies, we will now consider the concepts and relationships that may turn out into analysis. Example, in the interface terminologies, yesterday, we do have 20 inpatients. For outpatient, for today, for the interface terminology, we have 25 inpatient and we have 20 outpatient. So from the data that I have presented, the inpatient and outpatient, can we analyze the data that I have presented to you? Is there a significant increase or decrease from inpatient? The answer is yes. Why? Yesterday, we have 20 inpatient, and today, we do have 25. So a difference of 5, an increase of 5 inpatients. So there is a significant relationship of the two data that have been presented, and that significant relationship is there is an increase in the number of inpatient. How about for outpatient? Outpatient, we have yesterday 15. Today, we have 20. Is there a significant relationship? The answer is yes. Because from 15, it increases the number of admissions, or rather outpatients, to 20, a difference of 5. So now, if you will compare the data of inpatient and outpatient today and yesterday, that is what we call comparison and aggregation of data, which will give you the analysis through the statistical presentation. It could be graph, it could be pie, it could be percentages. So this data that will be shown to you by graph, by pie graph, by bar graph, by percentages, these are reference terminologies. Students, okay, if none, I will continue. Number 5 is we have interoperability standards. If we say interoperability standards, these are the technical standards for exchange, integration, sharing, and retrieval of electronic health information. I will set here an example when it comes to MCU virtual learning environment platform. The technical standards were in if your professor have posted specific data or file in the MCU BLE, the answer is yes. To what extent the professor can do the restriction access of when it will be available, of what time it will be available, and to whom it will be available. To the concerned students that can access the file, can it be shared? Yes. To what extent? The file, just such as assignments, the template can be downloaded. So it can be retrieved. Okay? For those who have retrieved with the template and you have filled out the template with your assignment, can you upload your assignments? The answer is yes. When you upload your assignments in the MCU BLE, can the teacher access it? The answer is yes. Can the teacher or professor will make marks on it or grade it? The answer is yes. It can access the submitted outputs of students. As a typical example in MCU BLE. Let's have interoperability standards when it comes to health center. Technical standards for exchange. Remember, in health centers, we have doctors, we have nurses, we have midwives, we have nutritionists. These are the health team in the community. To provide holistic healthcare to our community people, all of these members of health team will do collaborative work. For example, let us now identify in the community, for example, who are those diabetic clients. Can anyone access the information or rather the data of diabetic clients when it comes to that community? The answer is yes. But if it started with the what we call interface terminologies, if someone indicated and surveyed all people in the community and entered there a menu of those who have been identified and diagnosed with diabetes, then that is interface terminology. Reference terminology can be now used if diabetic clients are being identified and now the data that being used for diabetic range to identify the older population and adults. Then now, those data have been divided into two. Diabetic, who are adults, diabetic, who are older population. Can we compare the two? Yes, because if, for example, in that community, by reference terminology, we have 50 diabetic clients who are on the older population and 25 of adults who were considered diabetic in that community. Can we do comparison? The basic difference is that of 25 higher number, 25 higher number can be considered for the older population compared to adults. If we will try to convert this into percentage, almost 50% of the population are considered, or diabetic clients are being considered with older adults. So that is now reference terminology. Interoperability standards comes in if, for example, the doctor can now access all diabetic clients in the community. The nurse can also access all the information that had been stored in the computer of the health center. Nutritional plan for diabetic client can be done. And through the nutritionist, she can have access on diabetic clients in the community. This is a form of information exchange. For the doctors, the nurses, and the nutritionists, can they download the file? If it could be exported into an Excel file, then that could be exported as part wherein it is converted into MS Excel format. Now, can it be shared? If it could be downloaded by anyone in the health center, then that is already retrieval of electronic health information. The process of exchange, integration, sharing, and retrieval of electronic health information is what we call interoperability standards. Now, considering the key points on data, information, and knowledge, we have the person who is basically responsible. If without this person with his competencies and skills, we cannot process basically they are responsible for transformation of data into knowledge, interpretation of data based on worldview. What does it mean? From the control vocabulary, okay, from the control vocabulary that I have mentioned about international use of the international codes, only those who are trained nurses and medical transcriptionists may significantly interpret these codes. But since it is international code, it could be worldwide, right? For all nurses, medical transcriptionists, the United States, Europe, Asia, if they have been trained with common, acceptable international codes, then this could be universal. If we say universal, this could be easily interpreted and fully understood by those who may be in other countries. So, common interpretation of data. And that is basically the work of informaticists. When we consider transformation of data into knowledge, is that of the data has been converted into information, and the information has been analyzed through comparison, has been analyzed through differentiation, has been analyzed to a higher level of thinking, then that has been a knowledge. So, there are threats in data interpretation. We have identified semantic tools. We have identified semantics. Semantic tools are meaning tools. Semantics are the way on how you will introduce meaning to a term, symbol, or numbers. What do you mean by semantic equivalence? Semantic equivalence is that of health concepts are complex. Okay, what do you mean health concepts are complex? These complex situations may have possibilities that it could be misinterpreted or misunderstood, even with the common health practitioners on how they will perceive it. Healthcare professionals have diverse vocabularies and perspectives. All of us, nurses, are aware, have learned concepts in school, but some of us may have various or different ways of interpreting data and information. For some, they have used 37.5 as febrile condition. But for some nurses who have access to other vocabularies, they have considered 37.5 as non-febrile. So this must meet the gap. There must be one reference at all. So if one facilitator or one professor mentioned unto you that the blood pressure of 120/80 is normal, but the other professor mentioned that 120/80 is already pre-hypertension. So what could be your basis of the correct data or information if it has reference? And we all know that 120/80 of pre-hypertension is according to the JCI, classification of hypertension. So, just like for example, semantic equivalence. An example below is elevated blood glucose, high sugar. What could be the common interpretation for both? We are referring to glucose, we're referring to sugar. But the next question is it referring to the level of glucose in the blood? Do the high sugar is referring to the ingredient or content of food? Do high sugar are referring to the food intake? So those could be complex. Some of us may tell our patients, and you have heard this encountered this in some of the community setup, your blood pressure is 150/90. And some of you will tell, oh, your 150 is high. That is in your heart. Your 90 is okay. That is in your blood. Remember, class. In colloquial, in Tagalog, they will mention, mataas yung sa puso mo. Pero mataas yung sa puso mo, pero yung sa dugo mo okay. Remember, the representation of 150/90 is as a whole as blood pressure. And that entails the function of the heart and both function of circulating blood. We may not divide it accordingly because the systole and diastole are two cardiac activities that we may not separate with it. So, just the same as for this example, elevated blood glucose or high sugars, which may cause a possible diverse vocabularies. Let us now consider semantic gaps. To solve the problem with semantic equivalence because of diverse vocabularies and semantic gaps. Data, a large gap between data and information. Example, elevated blood glucose. These are the questions which may validate why it happened that there is elevated blood glucose. Question number 1, what is the patient's typical blood glucose? Second question, what did the patient eat or drink? Third question, what medication is the patient taking? Do all of these questions may contribute to an answer specific to problems with elevated blood glucose? The answer is yes. But the elevated blood glucose can be triggered accordingly with the questions below. Because once we say elevated blood glucose, we could say that this is not the normal blood glucose that the patient had. That's why we have question number 1. What is the patient's typical blood glucose? Do you think that the blood sugar level could be influenced by what you eat and what you drink if it is high in sugar level? The answer could be yes, because that could be an answer also of elevated blood glucose. Next, a medication can trigger also elevation of blood sugar because there are drugs that may trigger the function of the level of blood sugar or insulin secretion that is supposedly will break the blood sugar. So that is what we call semantic equivalence and semantic gaps. Any questions so far?
None po.
Wala po.
Any questions so far from the first part of our discussion? Okay, so if none, I may give you first 5 minutes. We will continue our discussion pertaining to the concept of nursing informatics. Thank you very much. Okay, students, can we continue with our discussion?
Yes po, Dean.
Okay, thank you so much. To continue with our discussion, we are now heading towards the concepts of nursing informatics. We have identified the concepts accordingly with health informatics, basic introduction and health informatics. We have discussed also the concepts of the data, information, and knowledge, semantic tools, and the role of informaticists. Let's proceed to the next with our discussion on the informatics. Just also a reminder, class, that our discussion on the nursing informatics, we have also the in the MCUBLE, so that it will give you a much or clear understanding of what is nursing or more on nursing informatics. Same slides have been adopted, but I will just explore examples that are considered as our setup here in the local or national. As we start with our discussion, let's start first with informatics. Concepts of informatics has three fundamental components. Actually, we have three as of the people, processes, technologies. The technologies and processes, the considered end users are the people, because it gives us the basic reason of how to basically consider and apply data to become relevant, useful, and meaningful is through these three fundamental components of informatics. The people are the ones who are definitely in charge on how it will process the data, information, and knowledge. On the use of the technologies, these are the use of computer, various platforms that will generate, store, retrieve data. When it comes to the processes that we're talking about is pertaining on exchanging information, sharing information, storing information, and retrieval of information. So, as what I have reiterated, the end user are the people that have utilized among the triad technologies and processes the data to become relevant, useful, and meaningful. What do we mean by data that will apply to become relevant? Relevant meaning that if the data that had been converted into information can be useful for the individual or for the patient, which the appropriateness of treatment and appropriateness of care management can be considered. Typical example is that of the patient will undergo surgery. If the patient will undergo surgery, then clearance. The preoperative clearance will be initiated by the nurses, and the nurse will definitely gather data that will give information to whatever management or surgical management can be done to the patient. And once the client or nurses rather will have information that will clear the patient for surgery, then that is what we call relevant. Examples. A client who will be subject for surgery will be given or administered with anesthesia and other drugs. How this data could be relevant? The people, the person could be the nurse. The processes is it involves storage of the health information, electronic health information of the patient. The technology is it could be retrieved through the computer. Through these three, from the nurse, from the computer, and the storage of electronic health information of the client, the nurse can access the medication history. And if the nurse can access the medication history, it may identify the client's hypersensitivity reaction or allergic reaction to doctors either prior to surgery, during surgery, and after surgery. And that entails data to be relevant to the patient. Why again it is relevant? Because it indicates, or rather it applies to the patient the appropriate protection and preventive measures through the gathered data from the triad components of informatics. Next, from the three fundamental components of informatics, how data can be useful. For example, when the client has been hospitalized 3 times in that hospital, then, for example, the client will be admitted in the hospital for the 4th time. For a patient who will be admitted for the 4th time, it is expected that his or her records are intact in the hospital medical records. But since we're using informatics as to consider accessibility, and consider the level of usefulness, the nurse, the technology is the use of the computer or the system or the platform. The processes is on how the nurse can access and retrieve information. For example, if the client and the doctor wants to know the comparative results of blood sugar level of clients from first hospitalization, second hospitalization, and third hospitalization. The pattern of the blood sugar could be the reference of the doctor so that in his fourth admission of the same problem with blood sugar, there could be a more useful intervention to treat. It has been useful for the doctor for the therapeutic or treatment regimen. Will it be useful for the nurse? Yes, it will be useful for the nurse on how to prepare the care management plan. Next, how the data will be meaningful to the extent of informatics. Again, let's go back to the three fundamental components of informatics. For example, as the nursing service office. The nursing service office is composed of the chief nurse, supervisors, and the head nurse. There are the nurse administrators. How the processes and technology comes in. The technology comes in if the people in the nursing service will consider staff development for their nurses to gather information of the needed training of the nurses in that institution. Then primarily, the nurse administrators will survey the nurses when it comes to competency assessment. Before, it was traditional to distribute printed survey tools. Now, in the application of the specific platforms, applications that can be accessed through mobile phones, laptops, or even in your own desktops, survey can just be distributed in one sent mechanism. For now, for example, the people in the nursing service wants to know the data and information that they need for the nurses development program, training development program. They have used the technology. They have used the Google Docs platform. They've used the Survey Monkey. They even used the Zoom poll. So through this technology and platform, how this information and data gathered and surveyed, this could be processed if those assessments or competency assessments have been gathered, will be ranked accordingly. The highest need of the nurse when it comes to competency assessment will be the one to be considered as the first training that will be implemented for the nurses. So through these components of informatics, people, the nursing service, technology, the use of the platform, processes, the information gathered from the nurses had been processed as a result and through statistics and by ranking. Then this made the informatics, the data, meaningful. To proceed, let us now apply informatics in nursing already. The first slide, I have shown already informatics in general, but I have given also nurses as examples. For informatics in nursing, three fundamental components of nursing. For the people, we have now considered nurses. For technologies, we have considered now information technologies. The information technologies could be hospital information system. Now, the processes are considered healthcare processes. Then, this could apply the patient care and clinical data, the relevant, useful, and meaningful data. And once it will be considered relevant, useful, and meaningful, it converted now data into information. Now, let's have an example, or let's set examples. For nurses, we are aware of the hospital information system. In the hospital information system, it is not just only nurses can be involved. However, when we talk about nurses, the covered responsibility of the hospital or the covered hospital information system could be the common responsibilities of nurses. Do charting and documentation be considered the responsibility of nurses? The answer is yes. Do the record of medication that has been administered to the patient is the responsibility of the nurse? Yes. Do the completion of the preoperative checklist of the client prior to surgery will be the responsibility of the nurse? The answer is yes. So those are the responsibilities of the nurse. Those are the procedures that nurses may be engaged. But how we could use this information technology? In the hospital information system, we have platforms and ways on how to store this information. Upon completion of the pre-surgical procedure or checklist can be done through the use of the platform. Even for nurses can record or even identify the drugs that have been administered with the indication of time and who administered the drug. Next, the nurse can identify specifically the care management that had been done to the client through charting and documentation through the use of the platform. How the healthcare processes comes in. The healthcare processes comes in if the storage and the access could be done within the institution by the authorized persons. Who could be authorized to the nurse's documentation? It could be the head nurse. It could be the chief nurse. It could be the physician. Will the billing staff will have the access on the charting and documentation of the nurse? It's not necessary. So that's why it limits in the processes that the only professionals that may have the access rights are the doctors, the colleagues among their nurses or co-nurses, and the head nurse. So this comes in the healthcare processes, or they can retrieve information to become relevant, useful, and meaningful. Any questions so far, students? Any questions so far? If none,
None po.
thank you so much. I may proceed. This is how American Nurses Association defined nursing informatics. American Nurses, or ANA, define nursing informatics on the following. It is the interrelated concepts on nursing science, information sciences, analytical sciences. Actually, analytical sciences could be computer science. Nursing informatics as a specialty, okay, a specialization as according to the American Nurses Association, will use the three main concepts. Nursing science is through the use of systematic way on how to manage procedures that are identified in the hospital. And so obviously, when we say science, the nurse becomes systematic. The nurse will process it step by step. The nurse will definitely consider rationalization of every action that she or he will plan to do. When we talk about information science, it's a systematic way on how to process information. The systematic way on how to process the information is through the use of the what we call data that has been converted into information. Information sciences, which is a systematic way on how to store data, how to retrieve data, and how to access data, is part of the information science. How to give restrictions on the access of the information is information science. How to use various platforms on the storage, retrieval, sharing, and exchanging of information, that's it, that is information science. When we talk about analytical science, the analytical science may consider also the computer science. It is on how we will use this information to what extent. If this information may be used to the care management plan for 1 week of the patient, that's analytical science. Long-term care plan, long-term and care plan for the client. The medications that have been administered for 1 week can be done by analytical science. The side effects that have been experienced by the nurse, but rather by the physician, by the patients themselves. I'm sorry, I stand corrected. By the patients themselves can be recorded and been analyzed as well. So through this analytical science, the physician may discontinue the drug. The physician may change and prescribe a new drug. The long-term care can be done through the analysis of the information that can be retrieved by period of time. Again, in the information science is on how the nurse systematically process information. In nursing science, it is on how the nurse utilizes her skills, her knowledge, and her competency in the processing of information. Through this area of three interrelated concepts, these informations can be done to identify, define, manage, and communicate. How can we identify? We can identify it in a way that if the data is useful, relevant, and meaningful. Another, how can we define it? If the data provided can be useful, relevant, and meaningful. Another, can nurses manage data meaningfully if it is useful and it could be relevant? Do you think the nurse who is aware of a systematic way of processing data with competencies and skills can communicate information that are relevant, meaningful, and useful? So the three main consideration of how the data can be useful, meaningful, and relevant are the ways on how these three interrelated areas can be utilized to identify, define, manage, and communicate. Let's set specific examples. How you will identify through the use of the interrelated concepts. If you find that the information, for example, you're attending to a client who have experienced vehicular accident, okay? You identify that the client with vehicular accident is in the emergency room. What are the necessary information that you may need? The necessary information that you may need to ask with the patient is the place where it happened, the nature of the accident. Third is what are the discomforts the client is experiencing. However, most of the responses of the client are subjective. It may not be only be a consideration for the appropriate care of the patient. Let us now define. For the client or for the nurse who have identified the subjective data, to clearly define this subjective data and validate it, we can define it clearly through objective data. If the client mentioned that during the vehicular accident, the first one that been hit is his head, to clearly define this data is to define it accordingly by diagnostic examination. And through diagnostic examination, it will specify clearly if it really affects the head. Data can be now managed accordingly, such as, for example, MRI. The results can now be useful to manage accordingly on how the client will be treated. Information could be useful. This information now could be useful because it specifies findings of the client. Then it could identify specifically the nurse can now communicate to the health team members, to the doctors as well. So that is a typical example. Identify, define, manage, and communicate. And through the nursing practice, we can now generate data into information, information to knowledge, knowledge, and now to wisdom. The wisdom could be achieved accordingly to the use of the nursing informatics if this is already the use of evidence-based practice and the flexibility of the nurse on how it will be utilized accordingly on appropriateness and target slide. The next slide, if you will see and notice in this area, the nursing informatics that have been defined accordingly with the three interrelated concepts, how the basic concepts of informatics, of data, information, knowledge, and wisdom is being processed in the nursing practice. The informatics can be now used in decision making. In decision making, it could be useful now on structures. What do you mean by structures? For example, from the patient who had been identified in the emergency room, it has been identified as structures of those individuals and professionals who may attend to clients who experience head injuries. How about processes? When it comes to processes, it will give us the workflow against the head injury. The nurse may enter data to the electronic health records of the client, and thus it may process this information as useful, relevant, and meaningful. And now in decision making, technology comes in because the nurse may not eventually proceed physically to the diagnostic rooms. She can just only access the results through the use of technology and various platforms. And who may benefit this decision making? The decision making combined with nursing informatics can be useful for nurses, for patients, interdisciplinary team, consumers, and stakeholders. And that comes out with the what we call desired outcomes. This framework gave us the idea that nursing informatics could be one area and specialization that the nurse can perform, that the nurse can be skilled, that the nurse can apply the acquired skills, knowledge, and attitude, which could benefit the decision making of the organization. which could benefit all the professionals who are working in that institution, and thus will attain the desired outcomes for these patients. Any questions so far, students? Students, questions?
None po.
None? Okay, so I'll continue. So there are only few slides left. On nursing informatics, actually, it was mentioned as according to American Nurses Association, nursing informatics is a nursing specialty established by American nurses in 1992. Here in the Philippines, we still do not have yet advanced nursing practice when a nurse could be certified as nurse informaticist. However, our setup here in the Philippines, nursing informatics could be achieved through a postgraduate program or masterate degree or even doctorate degree. When it comes to the scope of the nursing practice of nursing informaticists, they are guided with the scope and standards of practice because the specialization will also entail interrelated concepts. Just like here in the Philippines, nursing informatics entails your knowledge about Data Privacy Act, your knowledge about institutional policies, and your knowledge about processes of hospital information system. In America, in the United States, before you achieve nursing informatics specialty programs or complete specialty program and be certified, you need to pass a board certification exam offered by American Nurses Credentialing Center before you will be considered as nurse informaticist. Okay? Again, here in the Philippines, we still don't have the advanced nursing practice on this area. Now, let us now consider the roles of nursing informatics specialists or informatics nurses. Informatics nurses or nurse informaticists have significant role on the following: clinical information, clinical information and systems implementation. What do you mean by clinical information and systems implementation? Generation of electronic health records of every patient is considered as clinical information. All medications that have been administered to the client with the drug literature registry or drug and medication registry of the patient is part of the clinical information systems implementation. Supply room on the specific stock of supplies, that is also the use of clinical information system implementation. When we talk about the clinical information system implementation, this concerns with patient-centered care. Any care, management, treatment that has been done to the patient is recorded in the clinical information systems implementation. Any performance of the procedures that had been recorded electronically and through the use of information system is considered as clinical information systems implementation. And if the nurse performed those responsibilities, that's one of her roles. Systems maintenance. When we talk about systems maintenance, this concerns on how you consider the use of the system consistently and without error. Okay. The purpose of utilizing the information system is to mitigate error, as we discussed in the health definition of health informatics. Mitigation of error could be because mitigation of error, prevention of error could be possible because nurses can easily access the basic information that she or he may need before administering care to the patient. The systems maintenance that we're considering is that of if the platform is efficiently used by nurses, if consistently used by nurses in record keeping, that is systems maintenance. Another role of nursing informatics is to develop the competencies and skills. Education and training, even nowadays, can be done through various platforms. Google Meet, Messenger Forum, Zoom platforms. Education and training can be done virtually. However, it may set limitations as well. But the nursing informaticists or informatics nurses may innovate ideas on how to still consider and achieve the desired outcomes on the continuous professional development of nurses. Next, data analysis and reporting. Nurse informaticists can generate data analysis. One of the examples that I have mentioned is if you wish to know the inpatient and outpatient data for every month, for the whole year, quarterly, and even analysis on a daily basis. This could generate the data if it is stored correctly and efficiently in the storage facility or hardware or platform. the manner of reporting could be efficiently done through the what we call various platform and can be easily accessed by all professionals who are working inside the hospital or even outside the hospital for efficient communication. And this data analysis can be done with the role of the nurse informaticist. System optimization. If you say optimum, you need to maximize the use of the system. If you have utilized the technology from care management to care management to recording and documentation of care management, then eventually systems optimization can be also done as a role of nurse informaticist in his or her relation to other departments, how she or he will communicate and access information and data from other departments. An emergency room nurse can endorse a patient to the ward, even with the initial entry of the patient's electronic health records. And once the client has been admitted in the ward, the nurse or the ward nurse have already accessed beforehand and before the patient arrived about his or her information. The relationship of the nurse in the emergency room and ward nurse have utilized the technology, have utilized the processes, and manages all this information into meaningful, relevant, and useful information. Thus, nurse informaticists could be part of a team because he can collaborate with other team members. As what I told you, the healthy members can have access rights to the information of the lead. You could lead the nursing service office on how the nurse can maximize and optimize the use of informatics in the hospital system and with the care management of the patient. So, when it comes to nursing informatics competencies for all practicing nurses, why consider nursing informatics competencies to be at least recommended to practicing nurses? Why? Because advancement in technologies in healthcare. Remember, according to statistics nowadays, 95% of hospitals and 85% of physician offices have already adopted electronic health record technologies. So this could be an advantage. Another advantage of why taking or having nursing informatics competencies and why this has been integrated in our curriculum. Significant impact on nursing practice. Nurses represents the largest group of professionals in healthcare. Not just only the largest group of professionals, but also with the fields of specialization. Electronic health records driven regulatory requirements. It will promote interoperability. Again, as we define interoperability standards, it is on how we consider retrieval, exchange, storage, and accessors is necessary now for a nurse who will be entering a premier hospital and even government hospitals or any institutions. So what are the basic competencies that you may need if you want to be a nurse informaticist? Basic computer competencies are the following. You must have the basic knowledge on computer hardware, software applications, as well as the use of the internet and online resources. I know for a fact that all of you are more advanced on this, and yours truly is still adopting. Information literacy is another competency that may need. The left side are the advantages if you may have the competencies. The right side is what would be the requalification or the prerequisites if you want to have this confirmation on how you consider information as for the support care of your client and how you will use electronic health records for standards of care. Next, information management. As information manager, the use of electronic health records and with the use of the technology could be your advocacy as well on how it will utilize other concepts on data, protection, security, privacy, and confidentiality. Information management here in the Philippines are being protected by the Data Privacy Act. So I think this could be my last slide. This could be my last slide for this discussion. So students, I hope you have learned for this afternoon's synchronous session. The basic information and discussion on this will be posted in NCUBLE. The recorded discussion will be posted also for your consumption. Other information and links